I like that.
Gracias, Mariela. I'm also very honored that Richard Parker has accepted to give a keynote lecture in this WAS Congress, especially that I've met Richard long time ago, and we started to meet in the HIV conferences. I think it was in Amsterdam or in Berlin, and both of us were young and handsome at that time, and we were students of John Kenyon, to whom I want to remind the memory, who taught us sociology, sexual script theory, and etc. Then we continued to work more or less together, and Richard started a career at Columbia University, but at the same time he had also a life in Brazil, in Rio de Janeiro, and he published an important book, Corpus y Prazeres, Body and Pleasures, about 20 years ago. And then you published also another book called Beyond Ecuador, which are very sound anthropological books. So beyond his career at the Division of Social Medical Science at Columbia University in New York, Richard started a career in Brazil as chair of the ABIA organization, Brazilian Interdisciplinary AIDS Association, in which I think you are still the chair or an important member of that association. And for a few years, he was invited professor at the Institute of Social Medicine at the University of the State of Rio de Janeiro. So he has a long life partner, also Baba, who is taking picture in the audience, and then back and forth between the New York and Rio de Janeiro, and currently he is senior invited professor at the Federal University of Rio de Janeiro. So it's my extreme pleasure to invite Richard to come to talk.
Thank you, Mariela and Alain, for those very generous introductions. I'm going to start by asking forgiveness. I have packed far more into this presentation for half an hour than it is possible to do in half an hour. This is still a work in progress, so it's partially unfinished in many ways, and I appreciate your patience with any confusions that I may present. Basically, what I want to try to do is to build on work that we've been doing now in Sexuality Policy Watch for nearly 20 years. And I have to acknowledge my close collaborators, Sonia Correa, Gloria Cariaga, Ross Pacheski, and a wide range, Kenneth Camargo, a wide range of many other people who've been involved in this work. Basically building on a number of waves of research that SPW, Sexuality Policy Watch, has done. Whoops, I'm going in the wrong way. What do I need to do? Okay. Building on a series of projects that SPW has done that combine archival research with discourse analysis, ethnographic case studies, visual methods, and digital storytelling, and a good deal of eyewitnessing for those of us who've been around these fields for 40 years. We're trying to develop an overarching analysis of some of the trends that have shaped sexuality and sexuality politics globally over the course of the past 4 decades, which is basically the time period that's contemporaneous, if you will, with what we think of as kind of high globalization. Globalization has been going on for a long time, but it intensified in a profound way in the 1980s with huge impacts on almost everything else in our lives. And so that's a kind of backdrop for some of the arguments that we want to present here. We're also trying to tell a story that links a number of things that aren't all that often linked together, I think. Macro geopolitical forces certainly are part of our story. A focus on social movements, both social movements that I think most of us in this room would think of as positive social movements, progressive social movements, but also social movements that are not so progressive, that are conservative, reactionary, and dangerous. Links also with cultural frameworks and meanings, including some big cultural frameworks and meanings, and with institutional structures, institutional systems. And together, these different elements link together, we think, in shaping debates and practices related to sexual health and sexual rights in global arenas over the course of the past 4 decades. I think there are at least 4 important moments in this history. They don't map exactly onto the decade from 1980 to 1990 or 1990 to 2000, but they are roughly 10 years long. Just a little less perhaps. The first of these that I want to call attention to is the emergence of health and human rights as intersecting frames addressing issues related to sexuality during the 1980s and the 1990s, especially from 1985 to roughly 1992, 1993. The discourse around health and human rights began to take shape, and I'll say more about it momentarily. Then the second moment, the articulation of a new concept of sexual rights, called with that terminology, from the mid-1990s through the early 2000s. The third is the development of growing global social movements, and what's especially important is that they're global. There were social movements before this time related to sexuality, but they start to articulate transnationally much more actively in the 2000s, roughly 2001, 2002, running forward to 2010, 2012. The LGBT movement, the feminist abortion rights, reproductive rights movement, the movement of people living with HIV and other AIDS activists, the sex worker movement, increasingly the trans movement, take shape globally, articulate globally during the period from roughly 2002, 2003 to the early 2010s. And finally, the growing backlash against sexual rights frameworks on the part of conservative and extreme right-wing political movements since the early 2010s, and especially in the mid-2010s, with the wave of populist political figures elected around the world. Okay, so the emergence of health and human rights in the late 1980s and early 1990s. I think there are at least 2 especially important forces that need to be thought about here. The first is the emergence of the HIV epidemic. Anyone who was at Gary Dowsett's excellent talk yesterday has some sense of just how complex this politics is, because he described it quite brilliantly, I think. And one of the things that was especially important about that was an initial attempt to articulate an idea of human rights as related to health and especially related to sexuality, even though not always articulated in those terms. It was actually much more frequently described as stigma and discrimination. And human rights was only gradually towards the end of the 1980s began to be discussed as a way of thinking about and responding to these issues. Betinho, the Brazilian social movement leader and person living with HIV in 1988 gave, I think, the first talk that actually articulated AIDS as a human rights issue, in a talk he gave at the Faculty of Law of the University of Sao Paulo. And shortly thereafter, people like Jonathan Mann began to articulate the idea of human rights as well on a global stage. And it was linked to especially sexual stigma and sexual discrimination, and the discrimination of non-normative sexualities and genders. That was the way the AIDS movement began to sew together this notion of health and human rights. That was happening at roughly the same time that a revolution or paradigm shift began to take place in the population field, which since the end of World War II had been basically focusing on population control and was rightly criticized by the feminist movement in profoundly effective ways. It began to rethink itself in the 1980s, and especially the late 1980s, as it began to make the march to the Cairo conference that would happen in 1994. It began to rethink itself as a field of reproductive health and reproductive rights, rather than a field of population control. There was also a big macro factor that I think was important, and we failed to realize just how important it was, which was the end of the Cold War period, the breakup of the Soviet countries in the Soviet bloc, the fall of the Berlin Wall, and an end to a certain kind of militarism that had dominated the world between the end of World War II and the end of the 1980s. And that militarism was also fundamentally linked in important ways to a kind of culture of machismo and of aggressivity that created a backdrop for policies which legitimated certain kinds of approaches and excluded others in ways that I think are important and that I'll come back to later in this talk. And then the key role at the end of this phase of the UN conferences that emerge out of the end of the Cold War, opening up new possibilities for how we might think about issues of security in a post-Cold War world. You know, the Vienna Conference in 1993, which was absolutely crucial for coming to think about health and human rights as the key for thinking about HIV, for example. The Cairo Conference, where the paradigm shift is announced as a triumph to the world, and of course the Beijing Conference, which is where we finally managed for the first time to get sexual rights as a term into an international document. Until then, it had been proposed in places like Cairo, but it had always been scratched out before the final document was approved. Now, there were key advances during this period. Obviously, a gradually growing integration of work related to HIV and AIDS and reproductive health and rights, with sexuality being the point of intersection for bringing those two fields together. The field of health and human rights is a meaningful umbrella in which work under these previously disparate arenas could be accommodated and nurtured. The journal Health and Human Rights was founded in 1994 at the end of this period, or the beginning of the second period that I'm discussing. The Harvard Center on Health and Human Rights was founded in 1993, if I'm not mistaken. There was a significant expansion, largely funded through AIDS research dollars, for research on sexuality, sexual practices, sexual cultures, and communities. As we were talking earlier this afternoon, new emphasis on surveys of sexual behavior, but also a kind of social constructionist critique of essentialist assumptions in much sexuality research that emphasized as well meanings, practices, cultures, communities in ways that were important. And all of these things took off in a new way in the 1990s, and in a new climate again of kind of innovation, reaching the end of the millennium, ways in which in a post-Cold world we could reinvent the idea of development globally and reinvent global communities and networks. In this period, sexual rights really began to come of age. Ross Pachesky years ago described it as the new kid on the block in the expanding scope of human rights thinking, because of course human rights is a long history of trying to expand the meaning of what should be considered as relevant human rights issues. And the 1990s was really the decade of sexuality coming to the fore in that respect. At both Cairo and Beijing, the conferences served as a focus for activism and for advocacy around issues of sexuality, sexual health, and sexual rights. It was hard to get sexual rights language into the official documents, as we know, but civil society organizations, activist groups around the world, both in HIV and AIDS and in reproductive health and reproductive rights movements, continued to push the envelope in relation to these issues. There was also a further expansion of sexuality research and programs and of institutional spaces. I've been struck in trying to write about some of these old memories, how few institutional spaces there were in the 1980s and how they began to explode in the 1990s, to open up new places where we could talk, where we could address these issues, where we could begin to flesh out what an idea of sexual rights might mean, for example. So some of the key advances during this period, well, one, we should wave the WAS flag just a little bit. The key role of the WAS Declaration on Sexual Rights that was articulated in 1997 and revised and further developed in 1999, and that was a really important step in trying to flesh out. I mean, the first thing you do when you start talking about sexual rights to people who don't relate to that concept very much is they want to, well, what is it? And the WAS Declaration was a really important attempt to start to specify what should come under the umbrella of this notion of sexual rights. There was an equally important, huge role of HIV treatment access activism, especially after 1997, in making a concern with sexual rights linked to a concern with issues of global equity. The absolute inequity of extremely expensive medications that would be available only to people in rich countries and only to people in rich communities in those rich countries, thus making the lives of people who were unlucky enough to be born anywhere else or to live in any other kind of social circumstance insignificant, meaningful, and expendable. The notion that every life matters, and that had to be a point of departure for global solidarity around the politics of sexuality was profoundly important in the late 1990s. The gay movement in many ways around the world led work in this area. But the thing that was most important was that it moved beyond any one particular identity group or a politics of identity to really develop a politics of solidarity. And the politics of identity merges with the politics of solidarity, I think, in the build-up to the UNGAS Declaration of Commitment and the Doha Declaration on TRIPS and Public Health in 2001, which in some ways is the closing year of this second chapter that I think we want to look at. Then, in the 2000s and 2010s, a growing range of diverse global sexual and gendered social movements emerged. Feminist movement working on abortion and reproductive rights transnationally, LGBT and sometimes TQI persons and activists working also globally, people living with HIV and other AIDS activists, sex worker activists, most recently trans women, trans men activists, and sometimes intersex activism, a number of global movements around sexuality and gender issues, and around emancipation in relation to these issues became especially important over the course of the 2000s. Yet these global networks frequently operated and developed along relatively distinct tracks. If we had achieved a kind of global alliance around treatment activism at the end of the 1990s and the beginning of the 2000s, at the time of the UNGAS Declaration, for example, moving forward from UNGAS, we saw far too many of the old patterns of the global capitalist system, of a series of conflicts and contradictions that separated groups out in relation to solidarity began to return over this period. I think it's not entirely an accident. If we had had a slight window of freedom in the 1990s from the militarism of the Cold War, we went back to militarism exactly in between the UNGAS Declaration of Commitment and the Doha Declaration in June of 2001 and November of 2001. September 11th happened. The United States charged itself up for its war on terrorism, pulling all of its allies into a remilitarization and the kind of militaristic machismo that was the mode of operation for so much of international relations prior to the 1990s came charging back in a new perverse kind of way, and became the backdrop for many of the things that would happen in the 2000s, and I think the stimulator for many of the things that will happen are happening now around us in the 2010s. During this period, it isn't that advances totally fell apart. We continue to see some advances in the discussion of sexuality in the public domain, and in some of the most important policy debates at the highest levels. I never would have imagined in the 1980s or the 1990s even that you would have US presidents talking to their allied leaders and whatnot about issues related to sexuality. But in the 2000s, certainly you had issues of sexuality being discussed as legitimate policy issues in all the global fora of the world, in different ways and we wouldn't always agree with, but nonetheless taking on a policy importance that it never had before. But the context in which that takes place moved radically after 9/11, with the remilitarization of global politics under the rubric of the war on terrorism. And global solidarity between North and South increasingly falters and fails to truly transform existing trade relation systems and intellectual property regimes, which, by the way, are the Achilles heel of efforts to try and make treatment access a reality for everyone who needs it in the world, a world which is far from ending AIDS, of course. Scale up of the global AIDS response, which comes to fund a large part of global service provision related to sexual health, increasingly relies on the re-biomedicalization of the response to the epidemic as opposed to rights-based responses, and becomes a key source of financial support for faith-based organizations and evangelical Christian expansion. WHO in 2004 estimates that 40% of the health services for people with AIDS around the world are provided by faith-based institutions. That has only grown since then with the funding that PEPFAR has pumped into evangelical Christian well, they say it's pumped into faith-based organizations, but essentially it's pumped into evangelical Christian organizations around the world. In the 2010s, then, it perhaps is not so surprising that what we've begun to see is a backlash against sexual rights frameworks led by extreme right-wing movements, starting as early as 2012, 2013, but especially expanding after 2015, 2016. In this is what I call the tumultuous 2010s, we see waves of political protest and unrest. In 2013, the Arab Spring, Occupy Wall Street, and I could name a half a dozen or more other similar examples as protests spread around the world. It was very hard reading through a glass darkly. It was hard to understand where some of those things were going, and in fact, many of them expired in ways that I think left us feeling unsatisfied. And on their heels, what we began to see was a resurgence of populism and neo-fascism with the rupture of liberal democracies around the world, as the work of people like Manuel Castells have analyzed. Attacks on sexuality, gender nonconformity, sexual and reproductive rights, and the communities and movements that have defended these kinds of issues became perhaps the single most important idiom for expressing right-wing rage. almost always linked in complex ways to racism and ethnic discrimination. Even though that linkage hasn't been adequately examined yet, it is almost always present in the way in which populism and neo-fascism has expressed itself in countries around the world, such as the two that I am associated with, the United States and Brazil, where with slightly different time frames, both of these things have been raging. There have been continued advances during this period, but they've also given way to serious setbacks. I don't want to say that we haven't achieved anything. Obviously, there have been victories for key issues such as marriage equality and for fighting against homo and transphobia, stigma, and discrimination in many countries. The Me Too movement and modest advances in struggles against sexual and gender aggression and harassment coexist with the unprecedented attacks on the so-called ideology of gender, which have become a focus for right-wing and religious conservatives. One of the outstanding sessions at this conference focused on that, on the issue of the attack on the ideology of gender, and at least, according to what I've heard in rumors, at least one session at this conference was canceled because of threats in relation to the realization of the event, although the story is still not entirely clear to me. But it's an issue that is clearly at front and center right now of battles that are being waged. We've also seen the almost complete biomedicalization of the global AIDS response, which is transposed into promises of the end of AIDS, specifically in 2030, just to meet nicely with the UN development goals, after all, but which is effectively a smokescreen covering up the continued suffering of millions of people who don't have access to HIV treatment in poor countries, the continued suffering of millions of people who have second-class access to outmoded medications in poor countries because the intellectual establishment thinks that they're good enough, even though the side effects that they suffer are terrible, and deaths continue to happen, even in places like Brazil, where there's supposedly universal access. It also continues to cover up, the end of AIDS discourse covers up the fact that no one has access to prevention as a right of citizenship in any country that I know of. So we've achieved some things in terms of access to treatment, but in rights language we might think of as negative rights to avoid the suffering involved if you don't have access to treatment. But we've done very little in achieving positive rights of accessing sexual pleasure as something legitimate for people to have without having to expose themselves to infection from viruses like HIV. So the last period that we've lived to has been a very difficult one. This is obviously a story that's still unfolding, and so there is no conclusion here. The point of seeking to lay out and analyze these four distinct moments isn't really to reach a conclusion. At some level, it's to seek to develop an analytic framework that we might use to try and think about the predicament that we find ourselves in, as well as to think about strategies that we might work toward going forward in such dark times. It's also to help us try to define the elements that need to be integrated methodologically and theoretically. We can't think about sexuality only in terms of sexual practices or sexual behavior, and not even in terms of the meanings and communities associated with sexuality. It has to be linked and thought about in relation to those macro forces, in relation to social movement struggles, both on the right and on the left, in relation to broader cultural frameworks, metaphors, meanings, and in relation to the social structures, the institutional systems that create both barriers and possibilities for responding to these kinds of issues. It also, I think, this is an ongoing theme. I'm hardly the first person to mention this at this conference. But it also emphasizes for us the incredibly urgent need for building alliances and coalitions among the diverse constituencies that come together under the WAS umbrella. If we don't work together to fight against the kinds of oppression that are being unleashed around the world right now, none of us will be safe. Whatever advances we may have had in achieving pleasure as a right will be under constant threat by the dangers that are being unleashed around the world, I fear. In any event, the goal was to try to raise these issues for us to think about, and thank you for your patience.
Thank you, Richard, for this very stimulating paper. We have about 5 minutes because he didn't use all his time. So we have 5 minutes for a couple of questions from the audience. If someone wants to ask a question to Richard, someone here.
Would you like to come?
Sí, go.
Así a capela. Esa. Ok.
Funciona.
Hola, buenas tardes. Soy Erika Copca, soy de México, de la ciudad de Querétaro, un estado pequeño en este país. Me da mucho gusto escuchar esta plática, porque justo todo lo que hemos estado escuchando son como los avances que se han tenido. Sin embargo, yo no había escuchado si realmente había una red que estuviera trabajando justamente con estos grupos de derecha o de ultraderecha que también están avanzando fuertemente. En mi estado hace unos meses se dio una plática en un foro para 1000 personas en el cual hablaban justamente de esa ideología de género, ¿no? Y cómo justamente médicamente profesionales de la salud le fueron a hablar al estado de Querétaro de lo mal que estaban haciendo eso. Y que esos tipos de movimientos de personas que trabajan con sexualidades, pues son personas que quieren hacer a sus hijos homosexuales, o son personas que quieren justamente infectar a la niñez de VIH-Sida. Entonces creo que realmente estos foros, y este foro y esta plática final que estoy escuchando, pues serviría mucho para justamente poder hacer redes y seguir avanzando, porque ya nos están alcanzando y creo que la gente por mucho miedo se esconde, porque no sé en los demás países, pero en mi país los activistas mueren por estar luchando por eso. Entonces, muchas gracias.
Buenas tardes. Muchas felicidades a Richard por una excelente exposición. Quisiera que pudieras profundizar un poco más en esta articulación que estás planteando de masculinidad ligada a la guerra, a la militarización, que ha tenido como momentos cívicos, ¿no? Y en este momento estamos presentes en estos países populistas que están haciendo uso de este discurso como de la guerra. Entonces, ¿qué es lo que tenemos? ¿Cómo podemos hacer esa articulación o esa profundización de ese tipo de masculinidad? Gracias.
¿Qué tal? Buenas tardes. Rocío Quintana, de Mérida, Yucatán. Habló sobre muchas contradicciones que separaron a los activistas en el año 2010. Quisiera ver si puede profundizar en estas y luego al final señala que es importante hacer un llamado a que hagamos alianzas en la actualidad para hacer frente a este movimiento. ¿Qué es lo que en este momento respecto al 2010 nos está impidiendo hacer estas alianzas? Porque yo veo como una indefensión aprendida de todos, como que hablamos de la derecha, pero como que nos quedamos hasta ahí y no veo acciones más vinculadas.
One more question.
Es
indudable que cualquier tema tiene un entorno que puede ser local, puede ser a nivel nacional, puede ser a nivel mundial. Pero a mí me parece que también hay que incluir en este tipo de congresos más profesiones, justo por lo que estamos viviendo. Aquí vemos muchos psicólogos, muchos psicoterapeutas, hay médicos, menos que nosotros, hay psiquiatras. Pero justo ante esta situación y lo que se vive en todo el mundo, pues, que es lo que yo escucho, la dificultad para educar, los prejuicios, todo eso que hemos estado escuchando. Me parece que sería conveniente que nos dieran una visión desde esos campos donde no estamos especializados. Escuché pocos abogados, pocos juristas, politólogos, economistas, que esto, ahorita con esta ponencia, que yo agradezco mucho, a mí me invita a verlo de un modo más amplio. Y queramos o no, también estamos en un ambiente muy plural. Esta parte de la educación de la salud sexual es un ambiente muy plural que tiene que incluir otras profesiones.
Many good points and not enough time to respond to all of them. Yes, I think it's important to say, I don't want to be misunderstood. I think we've had huge gains. HIV treatment is the most obvious example, but it took us 20 years to treat 50% of the people who need it around the world. So there's obviously something that blocks that success. For the UN and other agencies to tout it as the end of AIDS is not only myopic, it's simply, it's almost genocidal. It's cruel and unusual punishment. So we need to talk in every area, and that's just one example. In every area, we need to talk about the things that are not going so well. We can't just pat ourselves on the back. The issue of masculinity, war, militarization is something that I've only started thinking about fairly recently as I've looked at some of these kinds of trends and breaks that I looked at and associated with them with some of the trends that have happened in terms of global military patterns. And again, I don't want to, I'm not arguing that there was no militarization of things in the 1990s, for example. There were tons of wars going on, genocides, but they were localized wars that were not legitimized by a kind of global ideology of this war, this vision of war is the way things are and the way things should be, and it justifies everything else that we do in terms of our policies. It's that large-scale justification of militarization that I think is especially damaging. The literature that's looked at militarism in gender, for example, in an earlier period of time, it mostly comes out of the 1990s and at best the early 2000s. There's been very little work recently that looks at that. Partly it's because, at least in some countries like the United States, there's almost a pressure to not raise any question about the troops and the war on terror and all of its positive things. You line up and let the troops onto the plane first. I mean, it colors everything that one does, and it's difficult for people to break through that, to start taking it apart in critical ways, the ways that I think it needs to be done. And I think it's something that has just fallen out of style in terms of academic investigation, but it should come back into style because I think there's some real important things that it conditions in terms of what's possible politically in different places. On contradictions, alliances, rights movements, the building alliances is the toughest thing there is. And as I was preparing this talk, I actually went back and looked at a paper that I wrote at I think it was for the second international conference on health and human rights, and there was a panel on gender and sexuality. And what I emphasized was the ruthless effectiveness of the other side, of the people who promote the dangers, and how much better they have done than we in terms of building alliances. So I think it has to be a major priority for us in the future. There's one more question that I can't answer because I'm out of time, but the broader, the better. If we don't make this broad, we lose too many things that are important. Thank you very much.
Bueno, agradecemos que la sala se haya llenado porque realmente esta sesión lo merece. Creo que esta conferencia excelente nos ha hecho reflexionar sobre muchas cuestiones que tenemos que tener en cuenta en el análisis de la historia de estos procesos y de cómo se están viviendo en estos momentos. Y especialmente en nuestro continente americano están pasando cosas muy graves. Y este análisis que se hace es muy profundo, es muy integrador y nos está llamando a elaborar herramientas y a articular verdaderas alianzas que se muevan para que las cosas cambien. Es verdad, ahora estamos viendo la situación de Ecuador, Argentina, Brasil, muchos otros lugares, Europa, el renacer del neofascismo. Por todas partes están pasando cosas muy graves que afectan nuestros trabajos y no podemos dejarlo pasar. Tenemos que articular ese frente antifascista que se movilizó previo a la Segunda Guerra Mundial y que en estos momentos está llamando a todos los profesionales de todos los ámbitos de la ciencia para que nos enfrentemos a este posicionamiento del fundamentalismo religioso que se ha inventado ese término de ideología de género para demonizar a las mujeres y al pensamiento más revolucionario de la historia, que es el pensamiento marxista. Muchas gracias, presidente del Comité Científico Internacional y profesor, porque además permitirme hacer estas conclusiones. Hasta luego.